My name is Kimberly Ball. I am the director at Titan Shops, the campus bookstore here on campus. And about 10 months ago, I was diagnosed with stage 2B breast cancer. My cancer was initially detected when I went in for a routine mammogram. I was probably about a year late in doing it, and I had experienced some sharp pains, and so I just kind of went in, and I almost didn't do it the day I went. I had an eye appointment that morning and a dentist appointment in the afternoon, and I wasn't sure if I was going to make it to the next appointment, so I walked in. I have Kaiser. I had gone upstairs to my eye appointment, walked down to see if they could fit me in for a mammogram for 30 minutes, and they said, yeah, we can get you in, and so I did it and had my mammogram and went on to my dentist appointment and didn't think too much about it after that. Probably about less than a week later, I got a call, and they said, well, we'll need to have you come back in. We want to do an ultrasound. So went back in, did the ultrasound, and about a week after that, they called me back again and said, okay, we need to do a biopsy. So I went in for the biopsy, and that's when it really starts kind of hitting you, going, oh my gosh, what's gonna happen? So they did the biopsy, and about, say, within a week or so, I got a call from Kaiser. We had set up an appointment, and they called and let me know that they did verify that what they had found was indeed breast cancer. From that point on, it was kind of a blur. Like I said, it was about 10 months ago, so last October is when I had found out. By the end of November, November 30th, I had my mastectomy. So I did do a left side mastectomy, and by January, I just started chemo. So it was really rapid and fast from when they started, when I first found out. And then I had a 8-course treatment of chemotherapy over a 16-week period, so every other week. And so I was like, do people work while they're on chemo? And so I found, some people work, some people didn't work. So it really just depends on how your body reacts. So I talked to my doctor, and I said, I really don't want to be out of work for 16 weeks. Can I work while I do this? And they go, well, yeah, you can try. And fortunately, I work for ASC, and they were super supportive of like, okay, you figure out what works for you, and we'll work with you along the way. And so I would have chemo on Wednesdays. And then the first 4 rounds of chemo, the drugs made you nauseous. It would make you feel sick. And so they, of course, load you up with drugs before they give you the chemo drugs. So the drugs for the drugs you're taking. And then I would, usually the 2 days after that, so Thursday and Friday, I would generally either work from home or use a sick day because I just couldn't do anything. And then I would recoup over the weekend, and then by Monday I was back at work. I kind of just really worked my way through it, and I think that actually going to work and keeping a normal routine certainly helped me through the process. I had additional support through actually a coworker that I did not know until I found out that they had also gone through breast cancer twice. And so she was super helpful. She was very, very cautious about how she helped me because she didn't want to overwhelm me or push me in one direction. Maybe I didn't want to go. But she would tell me, here's the questions you should probably ask when you talk to your doctor and get your results. Here's some of the things that I used as resources when I was going through it. Here's my experience. So she was super helpful. If I can provide a message, my message would be to definitely stick with your routine checkups. I mean, I was probably a year past when I should have gone in for my routine checkup, and I got a letter in the mail telling me my checkup was due, so it's completely on me. But I let work and life and kids and busyness get in the way, and it really honestly is I think I'm in and out of there in 20 minutes because you can just walk in at Kaiser and get your mammogram done, and I just failed to do that. So that's definitely my takeaway. My name is Kimberly Ball, and I'm a survivor of breast cancer.